All
Hello.
right.
Welcome.
Hi. Thank you. It's lovely to
Good to,
be here.
yeah, good to
Um,
have you on. Let's just jump right in. We're gonna talk a lot about quantum biology today. We spoke a little bit before we pressed record, and obviously a passion of the both of us. Can you tell me a little bit who you are, what you do, and how you use quantum biology?
yes, thanks so much for having me, and hi to everyone in the Netherlands. We lived in France for several years, and
Ah,
one of my
nice.
daughter's best friends is from the Netherlands. So,
Ah,
uh,
okay. It's close by.
lovely people. Okay, so my name is Meredith Oke. My background is in executive coaching, and I started to study quantum biology around 2017 due to a personal health issue. I had what I learned was chronic fatigue, though at the time it was a very ambiguous, just series of frustrating and disappointing encounters with healers trying to figure out what was going on. And then I came into contact with the quantum biology information with the importance of light and how light affects our bodies. And it was through listening to an interview with Jack Cruz, and I had a revelation because I was at a point in my journey where I felt like I was sort of up against a brick wall. Like I'd tried all of the things, I'd done all of the labs and all of the food and all of the supplements and seen
Right.
all acupuncturists and medical doctors, and everyone was. Some people would say, you know, your labs are fine, you're fine, and some people would say there's something really wrong, but I don't know what it is. Like,
Yeah.
uh, and so this light piece was like a lifeline. And I thought, oh my goodness, how could I have been ignored? I understood how important it is, right? I was
Yeah.
like, how could I have been ignoring it? And I started auditing my life, and it was like, oh my goodness, this is really bad. So the first few years, it was a personal journey. And then because I'm an executive coach and I've worked, my background is in the media and communication, I became really interested in how this was being communicated because it's quite a complex. If you get really deep into it, it's quite complex, though the practical
Absolutely. Yeah.
application is very simple.
Yeah.
And to me, I thought if this isn't accessible to be learned by healthcare practitioners who can then share it with their clients and patients, um, it's basically useless. So
Yeah.
I started the Quantum Biology Collective podcast, and we have the Institute of Applied Quantum Biology, where we have a certification for practitioners to go through the science in a structured way and teach it so that they can then integrate it in their practices.
Nice. That's awesome. That's something that you don't hear that often to build that bridge between what is already existing and what is new. We talked about that a little bit before we started as well. Can you explain a little bit about why quantum biology for most people is so new? While we have a lot of evidence in the circadian rhythm literature, but also in the quantum mechanics literature, why is this thing so new in your opinion?
Yeah, so I think there's a few different layers to it. As you just said, the research on circadian rhythms is irrefutable. There is, if put circadian rhythms into PubMed, which is a database of published scientific literature, right? Like I think there are now 90,000 papers in there
Wow.
talking about circadian rhythm in some capacity. The World Health Organization has recognized shift work as a carcinogen for a very long time. Uh,
Yeah.
why that hasn't then translated into people having a basic day to day understanding that the light that they're surrounded by matters to their health, I don't know. I think it might be because so much of the research focused on shift work
Yeah.
that people thought, well, I'm not a shift worker, or doctors thought by patients not a shift worker, it doesn't matter. But what is shift work? It's being awake at night. What do you need to be awake at night? Light. So if people are under artificial light for many hours past sunset, it doesn't matter if they're not at work.
No, I still
The
shift work.
body is still having the deeply negative effects. And so I think for the circadian piece, that research didn't bleed into the mainstream because it was so focused on shift work. That's that's my working theory. You could get into
Yeah,
other more
yeah,
fringy
more
type theories
complex
if you
stuff.
want to, but that I think that's sort of basically why. There's a circadian researcher called Dr. Martin Moore-Eid. I really recommend him if you're looking for interviews. He's brilliant at explaining the mechanism of how artificial light at night contributes to cancer, contributes to Alzheimer's, contributes to type 2 diabetes, all these things. He's very, very good.
Can you
Um,
give a super small summary
yeah.
of that? Like, okay, let's say I am not that shift worker, but I am the person who lives in Holland. So now we're in January, of course, and let's say six, maybe 6:15. It's dark outside, but I want to live my life, and then I
Mm-hmm.
use artificial light. Which implications um, is that having on my health, or maybe possibly on my health? What are the negative implications of that?
So, if we are lighting our environment past sunset with artificial light without thinking about it, we're just doing the default, using the default devices that are available to us, LED light bulbs, laptops on factory settings, televisions, we are definitely interrupting our circadian rhythms. People think, well, okay, so what? Because it's not well understood that our circadian rhythms control every single process in the body, right? So
Yeah,
you mess up your circadian rhythm, you're messing up your hormones, you're messing up your sleep, you're messing up your digestion, you're messing up your mood, you're like
literally
everything.
everything. Yeah, yeah,
Yeah.
yeah.
And that's a piece because we think, oh, circadian rhythm, like, oh, when I get jet lag, that's a problem. It's like the research on this, even the circadian researchers were shocked at the level to which circadian rhythm controls everything. Like the more and more that they dug into it, the more they were like, I cannot believe this. So yes, we live in the modern world. What to do? So there are ways to have artificial light at night that are less disruptive to the circadian rhythm if we understand how to do it. So the first step is recognizing like it's really, really bad, right? Like most people
Yeah.
probably wouldn't like eat an ice cream sundae and have a Coca-Cola right before bed,
Oh,
right? That's not something people would do, but they will lie in bed and scroll on their phone with their phone on factory settings instead of reading a book. And from the perspective of the effect on your body, it's kind of the same thing.
yeah, yeah. And some people say sometimes, and when I talk to them, like, yeah, but the ice cream, if I do that, the ice cream with the Coca-Cola, let's say I do that for 2 weeks, for an example, I notice it in my weight, I get
Mm-hmm.
heavier, or something in my body composition is changing. What would be things people have to focus on if they are now living that lifestyle? That they know, like, hey, that's an effect of being on the phone before I go to sleep, or having bright lights, or don't watch my light environment. What would be some physical symptoms that people can connect to that disruptive circadian rhythm?
Yeah. Well, interestingly, it can be different for different people, but I think the number one thing would be disrupted sleep, right? And that goes back to the importance of circadian rhythm, the importance of sleep and having high quality sleep also affects everything. Like when I interviewed a cardiologist, I'm like, what's the best way to prevent heart disease? Get good high quality sleep. I talked to an
Yeah,
ER doctor, sports medicine. What's the best way to keep your brain healthy? Get good quality sleep, right? Like
yeah, yeah.
so the good quality sleep is definitely going to be affected by having those bright artificial lights. So what does that look like? That could look like getting enough sleep but waking up still tired. That
Oh,
could look like waking up multiple times during the night and having a hard time getting back asleep. It could look like feeling grumpy. It could look like people might think like they're a bit bloated or a bit like that kind of puffiness that people get where it's not fat. It just like kind of has that your skin is just like a little like puffed out.
yeah,
It could be that could be related. Um, no, and then it also will affect your digestion and your ability to get through the day. So maybe like having a huge plunge in your energy partway through the day, that could be tied back to what you were doing the night before,
yeah.
in terms of what you did before you went to sleep. But generally speaking, it's not It's not like falling down the stairs. It's incremental negative change over time that we tend to write off of like, oh, I'm just getting older. Oh, I'm just busy. Or
Yeah.
I have young kids. Oh, yeah, of course I'm tired, But yeah, I would say that the number one red flag one is prolonged fatigue, right? Like
Yeah.
if you have the kind of fatigue that's not remedied by just catching up on your sleep, that's definitely a sign that there's something
Yeah.
going
Okay.
on.
And let's say I have those symptoms and I want to change something in my lifestyle to get rid of those symptoms and get a better quality of sleep. What would you recommend people do? Because, um, uh, yeah, most people start to understand, especially people who follow this channel, like, hey, I need to be more in the sun. But then there's also a lot of times like, yeah, I am in environments that I not can control. So let's say a workspace, or I go out for dinner, or I visit my friends and family. I don't have control over the light switch there. So what can they do to protect themselves but still use a little bit of artificial light?
Yeah, and that's the thing too, is yes, like we are of course all going to have light in our lives after sunset. Like if you want to be a purist, you would like have
Yeah.
candles after sunset and then go to bed, but nobody does that, which is
No.
fine. I think that the key things, there'd be three key things to do. The first key thing would be to really not look at screens the last couple of hours before bed. If you are going to look at a screen when it's dark outside, you want to wear the blue blocking glasses, which I'm sure you've talked about on this podcast, the ones with the orange
Absolutely.
lenses.
Absolutely.
Or
Yeah.
if it's your iPhone, you can go into settings and make the screen red. There's sort of shortcut ways to do that. You want to replace not turn on the really bright light bulbs in your home. So I don't know, in a lot of homes in North America, and yeah, I think that was starting to happen in Europe too, right? Like everyone has this sort of recessed lighting in the ceiling with tons and tons of light bulbs across.
Yeah.
Those just should not come on after sunset. And you have lamps with incandescent bulbs or a well-sourced full spectrum bulb, something like that.
Yeah.
Um, and that really makes a huge, huge difference. Just
Yeah.
those little things.
Nice. And are you also a proponent of having, instead of that still white orange light, is to change that for red light? What's your opinion about that? Are you a red light user at night when you want to read a book or something like
Yeah.
that? Or yeah, okay. Yeah.
Yes. So we
Yeah.
have incandescent bulbs in lamps around the house. And so after sunset, that's what we use, like when we're, cooking, making dinner or hanging out. If we
Yeah.
watch TV, we put on the glasses. My children think it's so annoying, but I'm like, well, do you want to play Fortnite or not? The glasses go on. But then once we go up to bed, and in that last time where I'm reading right before I go to sleep, I have one of those little red reading lights that clips
Okay.
onto your book, and we turn off all the lights in the bedroom and just have that red light for reading.
Nice. Nice. Yeah, that's something. I think that's very beneficial for most people to go to the red light, especially the closer you are to sleep. For example, now I'm in Mexico here. I have a lot of sunlight here, but when I'm here during the night, because it's an Airbnb, I don't have control over all the light bulbs, and I'm not
Mm-hmm.
traveling with them on. But I do have my infrared light panel with me, which I put
Right.
on during the night. So that's something I also want to talk about a little bit. There is a bit of let's say confusion about the difference between all the red light panels that are out there. Some are good, some are not good. Why are they good? Why are they not good? How to use them? Can you explain a little bit more about how you and the Quantum Biology Collective thinks about red light, and how to use, when to use, what to use?
Sure. Yeah. So I sort of break it down into different categories. There's the categories of light bulbs that are in most places in the world, in our homes and schools and things, that are LEDs or the fluorescent lights or the light. And those are just all trash. Like they're horrible and they're bad. They're just, we should replace them whenever we can. Then there's lights that you need to be able to see, as we were just talking about, when it's dark out, but you still want to be able to see. So that would be an incandescent bulb or there's a company called Block Blue Light that makes circadian friendly light bulbs. Those do not have any therapeutic effects. They just will not disrupt your circadian rhythms. They're circadian rhythm friendly. Then you get into the red light, which does have therapeutic qualities. So the red light that I use to read is just a light that's red, so that
Yeah.
it won't disrupt circadian rhythms.
No
The
therapeutic qualities there,
No
right?
therapeutic qualities to it at
Okay.
all. It's just strictly so I can read my book.
Yeah.
A red light panel or a red light therapy or photobiomodulation has different types of wavelengths built into it that mimic some of the wavelengths that are found in the sun, most importantly, infrared. And those do have a therapeutic benefit. And there's also actually, I think the photobiomodulation research now is up to like a couple hundreds of thousands of papers. Like
Yeah, there's a lot.
there's a lot, right? And it
Yeah.
shows multiple health benefits, but that would be something that you would use for like a 20-minute period to give your body that infrared light that we are all deficient in. So we're, back in the day when we were outside in a loincloth all day long and then in front of a fire and then sleeping in our caves, we were absorbing that infrared light from the sun, 12, 14 hours a day. Most of us now, especially if we live at a higher latitude, 10 months of the year, that's not happening.
No,
So those
no.
red lights give us that benefit, which we really need. So I think we have lots of red light panels, and I think it's something that's really worth investing in.
Nice. Yeah, yeah. I tell that to people all the time. If you want to
Yeah.
change your, let's say, after sunset behavior in the house, infrared light and a panel is really useful. So the company you work for or you build is mostly about the translation between healthcare professionals and moving into the realm of quantum biology and how to use that
Mm-hmm.
in their own practice or clinic or maybe even in the hospital. Can you tell a
Yeah.
bit more about how you guys do that?
Yeah, so there's two pieces. There's a community aspect to it where we do monthly meetups with people who have different perspectives on quantum biology and they share how they're implementing it. And then we have a certification which walks through some of the context and the history of what quantum biology is and then gets pretty deep into the science of the physics of it and what's going on inside the body. So those are taught by, we have a faculty of clinicians who teach that. And what we look for, and I think this is, what you and your colleagues are as well, it's like we look for for the teachers who not only understand the science, but have clinical experience working with
Absolutely.
patients and clients.
Yeah.
Because there's a lot
Yeah.
of people who can read the science, or there's
Yeah.
the Hubermans of the world who,
Yeah.
and they do a great service, I think, presenting
Absolutely.
science
Yeah.
to the public. But if they don't have that experience of working with people and seeing what happens in real life, in real time, then they can't really speak to the clinical application of it. And so that is, I think, like a really important piece that our community, and it sounds like your community in the Netherlands as well, is
Yeah.
really diving into, okay, the science is all there, but what does that mean
Yeah. Yeah.
for the person standing in front of me who's struggling with their health?
Yeah, yeah, absolutely. Because as you were saying before, the science can be a bit overwhelming, and all the connections because it's also coming from a lot of different fields, and that's
Yeah.
connecting. So when you're understanding that, then it doesn't mean you know how to, yeah, do that on a daily basis in your daily life. So let's say the people are listening to this podcast and say, okay, yeah, yeah, I don't want to read the science. Most people are interested in it, but they first
Yeah.
want to put some stuff to the test. What would be your top three things you would say, like, okay, you need to do that to find out if what we teach is working for you, yes or no?
Yes. And that's a great point. And I think most people, they want to know the science is there. They want to know
Yeah.
enough about it to trust that
Yeah.
that it's real. And then they're like, okay, now what
Yeah.
does this mean for me? So I would
Yeah.
say the number one, or for me, the top three things would be number one, spending more time outside,
Yeah.
right? Because as we talked about earlier, the importance of circadian rhythm and our bodies. I mean, it's so cool. It's so cool when you think about like what quantum physics has been able to articulate. That's always been happening since the dawn of time, but now we have this
Yeah.
incredibly cool science, right? Like our bodies are literally communicating with the biophotons of the sun like every single second of the day. And the
Yeah.
light is changing. And every time it changes and shifts, it sends a different signal to our body. And that information helps our bodies to know what to do and how to thrive and what hormones to make and what to
Yeah,
turn
yeah, it's
off and
almost
what
like
to turn on.
a
Yeah.
gearbox. The sun puts you
It's
in a different gear,
yeah,
and
it's
from there
like
on, a lot of stuff
it's
happens.
so cool. Like
Yeah,
it's just so amazing. And that's
yeah, it's
just
fascinating.
from literally opening a window or walking outside. And that's
Yeah,
why
yeah,
I get really excited about this because it can be a bit of a slog if you've got a chronic health issue or you're just really interested in health. You know, it's like, oh, is this organic and what chemicals and la 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 la. But like when you wrap your mind around this and you realize that like, oh, I'm improving my health just by stepping out in the backyard or on the
yeah,
balcony or having my coffee break outside instead of in the cafeteria or whatever it is, opening the sunroof on my car, cracking a window. It's like, it's so amazing. The sun
yeah,
is, it's just so amazing. So that would be my number one thing. Whether it's
yeah,
sunny, whether it's cloudy, whether you're in the
yeah.
shade, like whatever, out, out being outside.
Yeah, it doesn't matter if it's cold outside in Holland. That last week it was snowing, and I'm still
Yeah.
saying to the clients, "Go outside." Go, yeah,
Yeah.
but it's cloudy and it's cold. No, just go outside because the circadian clock in your brain, in your skin, in your eyes needs that information. And the fact that that's a nice point that I always see in people that we teach. I'm gonna ask you the same question in the beginning. They are really focused on what they see, oh yeah, the colors from the sun do something, and then they go a bit more into the science and they're like, what? Most of the spectrum of the sun I don't see, but all those different areas have influence on my body. It's like, wow, this is amazing, just what we are saying. And from there, if they're over that tipping point, like, what, I don't need to see it, I don't need have to feel it all the time. I don't need to be directly in it. Just the information that comes in is running my whole machine, my body. And from that point on, you see people, they're focused on being outside all the time. What you say, cracking open the window. It doesn't matter if it's cold or warm anymore. The information that it's good for them, it's like, okay, this is the most fun thing I can do. Just take care of my health just with being outside. So that's something you see. Sometimes you see that switch
Yeah.
point in people and they're like, damn, this is nice. And then they also go a bit to, let's say, their environment, and you see other people pushing to go outside. So yeah, it's a really fun thing to get your head around it. So number one would be sun. So we have that clear, the
Yeah.
logo of our company, you see it, the sun is
Yeah.
in there. So that's clear. What would be your number two thing that people can immediately do
Number
without
two would
studying
be,
everything?
yeah, reduce the artificial light after sunset.
Yeah.
By any means necessary, whatever you need to do. And some things would be easy. Like when I first came in contact with this information, I had recently switched from reading a book before bed to reading books on my iPad.
Mhm.
Because there was this new app where you paid $10 a month and read any book in the world. And I was like, this is amazing because I'm such a book junkie. So, and there was a part of me that was like, I don't really want to read off my iPad before bed, but oh well, all the books where all the books are now. And
Yeah.
so when I started to learn this, that was the first thing. It was such an easy thing to change. And it was the first thing where I was just like, oh my God, because I had been doing actually a little bit better because I'd made some other changes. And then my chronic fatigue like took a nosedive and I was like, oh yeah, I started reading iPads before bed. So there can be that low hanging fruit where it's like you could just easily that you could easily change the habit, do that first. And then I would recommend ordering the orange glasses. For some people, it's a real, like they just can't wrap their head around the glasses. I don't know why. I mean, it
Yeah, it's
took
so
me a while
easy.
too. I remember doing a consult with Dr. Cruz like years ago, the first time I met him, and I got on the call, and I was in France at the time, so it was nighttime for me, daytime for him, and I get on, and he's like, "What time is it where you are?" I'm like, "I don't know, 8 p.m." He's like, "Where are your glasses?" And
Yeah, yeah, yeah,
I remember being like, "Were you really serious about that?"
yeah,
He's
yeah,
like, "Yes."
yeah, yeah,
So
yeah.
yeah, turning off,
Yeah, he doesn't
turning
let
off
you
the
get away
screens
with that.
if you need them, put the glasses on. Yeah.
So the third thing, what is a tip people can use besides blocking the artificial light, be more in the sunlight? What would be your third thing to go about?
So point number three, I would actually say is moving dinner earlier because so food is also a circadian input. Light, I know we talked mostly about light, but it does matter when we eat. So our body works hard to digest our food, so we want it to be finished all that work by the time that we go to sleep, and that also affects the quality of our sleep. So moving dinner earlier not only affects the physical quality of our sleep, but it tends to shift our whole schedule a little bit earlier, which makes it easier to go to sleep earlier, which during the winter is really helpful to maintaining good circadian rhythms, like to get it a good get some good hours in even before midnight
Yeah,
really makes a difference.
and what would be earlier? How do you use that? Is it depending on location or?
Yeah. Okay. So it's based on two things, light and how far away it is from bedtime. So ideally, and I know that during the winter this is really hard, ideally you want to eat really close to sunset, if not before sunset. Um, so when the sun sets at 4:30 in the afternoon, that's a little bit tricky. The second thing is you want to have at least 3 hours, but four is probably better, of time lapse after dinner before you go to sleep.
Yeah.
So I personally play around with that. Occasionally on a Sunday, we might eat dinner at 4. During the week, it might be 5:30 or 6. So you can play around with that. But I do notice a huge difference in my sleep quality when I eat a really early dinner. So if it's kind of like, if you're just something like the light, right? Like we don't really think about it. We're just like, oh, we'll eat dinner when we eat dinner. It
Yeah.
is just worth being mindful of when you're arranging your schedule or you're arranging the routine of your evening. If you could have dinner at 5 instead of 7, that's going to make a difference.
Yeah. All right. Nice. And so that means that when you eat dinner, you focus on what time you do that within the season. Do you also focus on what you eat for dinner, or is everything okay when it comes to dinner within your normal diet, let's say?
You know, that's one of those things where it depends who you ask. I would say, I so the people who are really into this would tell you to have a really big breakfast within a half an hour of waking up and have a medium lunch and have a very small early dinner.
Yeah.
Uh, However, for us, we have children and dinner is our family meal. So we still like to eat we like to eat a nice dinner. So I
Yeah.
think, just focus on eating a healthy meal, whatever that means to you. But I do think eating it earlier is more important than what you eat, assuming you're eating real food.
Yeah, 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 of course. And
Yeah,
what we mean with real food is just like mostly organic, fresh stuff, and not all the processed and all the
exactly.
packaged stuff.
Yeah.
Yeah, yeah. So for us in Europe, that's a bit easier than in the States. When I am in the States, and that's not often, by the way, but it's like, oh, it's hard to get, like, in our opinion, healthy food here. It's tougher. It's so tempting with all the fast food. Not only fast food when it comes to, let's say, McDonald's or Burger King, but just grabbing a sandwich fast here or something fast there. It's just a bit harder to to get that under control. Do you see a big difference
Yeah.
for you in that when you lived in France and now back in the States, or is it you're
Yes.
so used to it? Okay, yeah,
No,
for you.
we miss it a lot. I mean,
Yeah,
in France, you would have yeah, two outdoor markets every week,
Yeah, yeah,
and
yeah,
then
yeah.
you'd get what the rest of what you needed at the grocery store. Whereas
Yeah.
here, we've sourced the farmers markets, but there's not as many in the winter. They don't have the same range of food that you would find in Europe. I order like my milk from an Amish farm in Pennsylvania and have it FedEx. Like it's really,
Yeah,
you have to
yeah,
work a lot harder to find healthy food.
yeah. That's something I noticed as well. All
Yeah.
right. So that was let's say a big introduction when it comes to what can you do to immediately improve your circadian rhythm and work with the principles. I want to ask you a couple deeper questions as well. And if you say like, this is not up my lane, or I don't like to answer, just feel free as well. One topic that comes up a lot, and especially I see there's a lot of interest now in it in Holland as well, on multiple platforms, by the way, is something that has to do with water, and that's called deuterium.
Hmm.
Are you focused on deuterium, on lowering deuterium? Can you explain a little bit how you look at deuterium, basically?
Yeah, so we tend to not be super focused on deuterium. We do have someone who is a guest faculty of ours who goes quite deep into it. Her name is Sarah Pugh.
Hmm.
She's amazing on deuterium. Um, However, the philosophy that we have really put forward is that if you get all of these other systems working well,
Hmm.
and you eat in a somewhat circadian aligned fashion, and you eat real food, and you pay attention to the quality of water that you drink. So you're not drinking tap water, you're drinking well sourced spring water or reverse osmosis water with minerals added back in. If
Yeah,
you're doing all of those things, I don't find it particularly necessary to go super deep down the deuterium pathway. Some people are very fascinated by that and they get really into it. And then you get into the importance of seasonal eating and all this kind of thing. Um, so we look at it as like a next layer down,
yeah,
but also if all those other things are in place, I don't think, especially just from a general perspective, it's too important to go deep on that. If you're a
yeah,
practitioner and you want to, go for it.
yeah. All right,
But from
cool.
just a general health and well-being, I think it adds a layer of complexity that's not necessary if you're doing the other stuff.
Yeah, and avoiding the tap water. Was that something is that something you do in the States, or did you do that as
Yeah.
well in France? Just move away from tap water.
Uh, what did we do in France? I think we checked if it had fluoride. That would be
Okay.
the
Yeah,
first thing. And if the water's fluoridated, you really do need to do reverse osmosis or outsource your water. If your water's not fluoridated, you could probably get a high quality filter and be okay.
and
But
why is
here
that the
where we
case?
are, pardon?
And why is that the case? What's wrong with fluoride?
So I'm not the person to go deep on that, but fluoride will, I mean, maybe you could add to it if you know, but fluoride will,
Yeah,
do you want to say?
yeah, yeah. It stops the electron chain transport.
Yeah.
So it's basically um, putting the brakes on the energy production in the mitochondria. Why I bring the topic up and ask you the question, because in Holland there is almost like a myth that we have the best water in the world, which in some years with the testing with some companies was the case, but we
I
are talking
see.
about 15 to 20 years ago. And now the water in Holland gets worse and worse and worse. But sometimes it's nice to hear it from somebody else that they
Yeah.
also focus on the tap water a little bit, like not like in a maniac style, but there are some stuff you don't want to drink. And fluoride is one of them, which is not used a lot in Europe, and also not in the Netherlands, but we find a lot of other chemicals in there in pretty high amounts. The amounts get higher and higher almost every year with testing. When you tell people, focus a bit on the water, just start with, okay, don't drink out of a plastic bottle, because we know that there's a lot of plastic parts per million in every droplet of water. Then you go a step further, especially when a person has, let's say, super bad skin problems, or in other cases like a real thyroid problems. And then we go a step further with giving them information about the tap water, and then that's what always comes up in Holland. Yeah. We're not America. There's no fluoride in it, so our water is fine, you know. So that's why I ask about France, because okay, fluoride is a big blocker of the electron chain transport, so you lose energy, which you don't want. But in Holland, there are so many other chemicals. For example, drugs like cocaine. Literally, we have a couple towns in Holland that have a lot of cocaine in their water system. It's insane. I know.
That's crazy.
I know. It's insane, and I don't know the exact numbers on that, but the amount of percentage that is going up when it comes to having synthetic drugs in the water in Holland, I don't know. The numbers are super high. It's like literally insane. So okay, water, deuterium for you guys, not a super big one. Because
I think that brings up an interesting point, because fluoride is really, really hard to get out of the water. And so, if you still really wanted to be able to drink your tap water, you would have to check what's in it, then check against the filtration system or the filter that you decide to use, and check if that filter is able to get those things out. And that's why I think for fluoride, because it's so hard to get out of the water, that if there's fluoride in there, you just got to drink something else.
Yeah. And you do that by ordering or buying spring water.
Yes, we have spring water in glass, the big glass.
Nice.
Jugs.
That's something we recommend a lot as well. Another topic I would like to discuss with you a little bit is also a very difficult one, or for at least for most people, is like the non-native EMFs. It's just like, those signals. Well, doesn't matter. It's just signals. When I have a phone to my head, I will not die instantly. No, you won't. You won't. That's true. But what are some, almost say, ramifications of being surrounded by those non-native electromagnetic fields, and what's your view on it?
Yeah, so they're not good. And it goes back to what, when we first started talking about quantum biology, right? And it's like, once you start understanding quantum biology and you start understanding that our bodies are connecting and communicating with the frequencies all around us every single second. So when you look at something like sunlight, it's really positive and life affirming to understand quantum biology, because you're like, oh my goodness, like all of these life enhancing, life giving properties and energies are coming in, are informing my body when I go outside. So
basically, you're built to attract.
Yes, and we evolved to work in synergy with those energies. So when you take that philosophy and then look at the man-made frequencies that we're surrounded by, right, it's kind of the opposite story. Our bodies, we did not evolve under these frequencies. Man created them without any understanding of the fact that there's quantum effects happening inside living systems. So they were able to claim that they didn't have any health implications because we didn't understand how our bodies really interact with frequency. So for those of us who
when we're researching it, we're not focusing on the right points to see if it has an effect. Is that what you mean?
Yes. So if you look at the body purely through a biochemical lens, it's easy to say, oh, well, this frequency doesn't affect the body. If you look at the body through a quantum biologic lens, of course that frequency is having an impact. And there's a lot of research to show that impact is negative. It's dehydrating our cells. It's not good. I find it a tricky rabbit hole because we are surrounded by these frequencies and a lot of it is out of our control. And I don't like to make people feel hopeless.
No.
So at a certain point, it is what it is. But to the extent that we can control what's going on, for example, inside of our homes, I think it's very important to be mindful of those frequencies. So at a minimum, right, that's just like turning the Wi-Fi off when everybody is asleep. Things like that, putting your phone on airplane when you're not using it. All these kinds of things do make a difference. There's also some really interesting research. One of our faculty members, Carrie Bennett, is doing some very interesting, she's down some very interesting rabbit holes in terms of biogeometry, and other kinds of modalities that could counteract and harmonize these frequencies so that they are less harmful. But obviously, the best way to avoid them is to not be near them
Yeah.
when it's possible.
Yeah, and in the beginning of the talk, we discussed like, oh, there's so much research about circadian rhythm and the implications of. What do you think is one of the main reasons, or multiple reasons even, that there's not a lot of, let's say, good data or not questionable data about the non-native electromagnetic fields? Because if you bring the topic up, then with the light, not a lot of people say, there's no research for that. It's just like, it makes sense, new, have to figure it out. But just even bringing the topic of non-native EMF up, it's like, no, there's no research for that. That's just all bullshit. Why do you think that's the case?
There is some research for it. It's just not widely accepted. And I think it's the case because it is so integrated into the fabric of our lives, into our paychecks, into everything that we do, that it's really difficult to, it's a very inconvenient truth.
Okay. So basically that's it. All right. So that's always an interesting one. But I think that's a good tip. That's the one we give a lot as well. Just at least don't put the phone in your pocket all the time. If you have an option to put it somewhere on airplane mode, that would be better. And when you go to sleep, there are pretty simple tools to you can have an automatic switch on, switch off at certain times for the Wi-Fi, or you just press the button on the back of the router, and that will help you.
And we actually, if your listeners would be interested, we actually sourced a Wi-Fi router from a manufacturer in Europe who did do the research and realized how bad the Wi-Fi routers were. So he designed one that's much better, and that's the one that we have. It works anywhere.
Nice.
It's called JRS, and it does a whole bunch of different things. One of the things it does is if nobody's using the Wi-Fi, it shuts itself off.
Wow.
And it also has settings so you can really, really lower the frequency output that's coming out of it. It's a good product.
All right, nice. Yeah, I will make sure that comes in the show notes, so people, if they're interested, they can look it up. And you were saying it's also available in Europe, right?
I think so. I think the person who started that company is European, but don't quote me on that. But it's not from around here, not from America.
All right. That's super nice. All right, we covered a lot of basic stuff when it comes to quantum biology, how you can use it as a listener. Is there something you have on the top of your mind, like, that's something I want to share that's not talked about enough within this area when we talk about the quantum biology area? Is there something you would like to share with the listeners, like, don't forget that?
I think what I would say is, however important you think light is, times it by 1,000,000. We've spent, our whole lives, we've been told to eat well, and more recently we've been told to stay hydrated.
Yeah.
But honestly, if we don't think about the quality of light that we're absorbing, it's just as important as those other things, right? And those other things can't even make the difference that they're supposed to be making if we're not illuminated properly, right? Like I think people here, they're like, oh yeah, okay, so that makes sense. I shouldn't look at my phone after sunset. But it's the unbelievable importance of light cannot be overstated.
No. I mean, we have a joke within the practice, like if somebody says, I want to know the nitty gritty of how light works, and then we say, do you really want to know? Because it's a lot. It's like, if you see it, you cannot go back. It's so I absolutely support that point. I mean, as a joke, we always say to clients as well, if they ask us, I ask you a top 3. Sometimes people ask us a top 10, and then I always, as a joke, say, 1 to 9 is light, and then
I love it. I love it. That's
after
perfect.
That, the conversation starts. So I would like to thank you for your time and the overview of how you guys use it. Of course, I will put anything in the show notes about the Quantum Biology Collective. Where can people find you to learn more about you and the stuff you guys do?
So there's the kwantumbiologiecollective.org. We're on Instagram at Quantum Biology Collective, and the podcast is the Quantum Biology Collective podcast. So, which I look forward to having you on now that we've met. I'm really excited. I have lots of questions for you.
Okay, good. Yeah, that's good. And maybe we can dive in a bit more deeper. But for our audience, the questions that they had were a bit more like, oh, what is quantum biology and how can I use it? So yeah, I'm happy to talk about it more. As you know, it's a passion of mine, of course, as well. So and we can talk about it for days. So that's we're gonna do that, and we're gonna try to keep it short for the people. Thank you very much, and yeah. For the listeners, thanks for listening again, and see you at the next episode. Bye.
Bye.